So I am Matt Hayes. I'm the product director for healthcare at Cyferd. And Cyferd is, essentially it's one platform to sort of build all of your business applications in. It's about simplifying the development process so that you can focus on your business problems more than actually sort of developing systems, writing code. And it's also a central contextual data layer so that you can stop capturing information in silos and start bringing it together in one system. Essentially it's one platform that you can build lots of different systems in. So my background, I graduated uni. Let's go right back. I was born back in the year of 1988. I graduated uni back in 2009 with a physics, astrophysics and cosmology degree, and had no idea what I was going to do with that, and then somehow ended up in the NHS in an IT department working on information security, and then sort of built a career within the NHS. So I started developing applications, solving people's problems, and did a lot of bespoke development, and then moved into business intelligence and essentially headed up the department of business intelligence analysts, data scientists, and BI developers as well. My background's very NHS-y, very problem-solving, but also seeing a lot of the pain points within the NHS that I was trying to fix while I was there, and I think we can fix those from outside. While I was in the NHS, there was a reliance on these really big systems. So the NHS in particular in acute trusts, they use a lot of, they have an electronic patient record normally at the centre. So everything's around this one patient record. And a lot of organisations still aren't very digital, so they have a lot of paper-based processes, and others have just lots of systems. But a lot of it's around these big healthcare systems, and they're really slow to change. If you can change them at all, so there's not very much flexibility there. There's so many constant changing requirements within the NHS. So the NHS is constantly trying to handle changes in the population. We've got an ageing population. Mental health is becoming a big issue. It's a changing sort of country, and there's financial pressures, etc. So they're constantly trying to come up with new ways of working and new ways of doing things, and they're innovating all the time. But unfortunately, the information systems aren't there to back them up quite frequently. So they don't have a place to work in a new way. They don't have a system to follow them, so they end up using spreadsheets and pieces of paper to capture that. So COVID-19 is a great example in that all of a sudden there was this requirement to capture lots of new information about patients, and also to display that information everywhere so that you knew if you were working with a COVID patient. And a lot of healthcare organisations just weren't set up to be able to start capturing that information. So again, it resulted to paper processes or really difficult workarounds. Finally, the siloed data. So with all these different information systems, you end up with all these silos of information, and it's a poor user experience having to use all these different systems because they're all different. You need training for each one. You miss things, and it's also difficult from an information point to pull that all together and actually present back to an organisation. So with the NHS, I guess so in a broader way, there's two sort of areas that we want to sort of help with. So one is these back office systems. So each NHS organisation, it has loads of back office departments. So they have their own IT service, they have their own finance departments, governance, project management, estate, supplies. So running all of these, they usually have their own bespoke systems. So actually what we think we can do is actually get rid of all those other systems, just use our one platform, and then build those systems in our platform. And also as we grow and as other people start using the platform, you'll find that people have already solved these problems, and you can download those templates into the platform. So you don't even have to build them yourself. You could just take a pre-canned approach. So hopefully we get away from all of these different systems, just have one. But yeah, the second way, and then we can get more onto specifics then, as an example, is then around like clinical and operational use. And so the other back office stuff is very generic. It's not really specific to the NHS, but it is a big problem for the NHS. But yeah, clinical and operational, there's, like I said, there's new requirements coming in all the time, and we need to be able to quickly build those. So for example, when COVID came in, again, great example, there was quite a lot of times where on a Thursday evening we'd be requested to start providing information from Friday morning about how many patients were currently on ventilators, or how many beds you had that could support oxygen, like oxygenation. And obviously the hospitals know that information, they work with that information, but they're not necessarily recording it in a structured way. So yeah, straight away they threw together paper processes, or they'd have someone bringing around the wards every day, and there just was no way to capture that information electronically. So with Cyferd, you'd be able to quickly throw together a way of capturing that information that you could send out to all the wards. They could just go into it and say how many patients they had, or they'd be working with their patients in the platform anyway, so we'd already know that they were on a ventilator, and we'd already know that that bed had a ventilator attached, etc. So it's really about being able to quickly take these new requirements and just provide something for them. There's others too, so not to go too in depth, but it's like complex discharge patients. So a lot of organisations, the focus used to be on, you have a patient in hospital, you treat them until they're better, and then you discharge them, and then you get another patient in. But what's happening these days is people's care is becoming more complex, and it isn't just about the hospital looking after a patient. Quite frequently when they leave the hospital, they need to go into some sort of social care. They need a community nurse to visit them at home. They maybe need a ramp building at home if they've lost the use of their legs or something like that. So it's not as easy to just sort of treat patients and then just discharge them. So that ends up with patients staying in hospital longer. So a lot of hospitals have got this concept of complex discharge teams. So when a patient arrives, they'll have someone assigned that will sort of flag that this patient maybe has complex discharge requirements, and they'll work with the patient, and they'll work with social care, and they'll work with other services to try and streamline that patient so that when they are healthy and they're ready to leave the hospital, they can leave the hospital at that point. It's better for the patient, it's better for the hospital because they've got a bed free to put another patient in. But again, there's no systems that are just ready to support this sort of thing. So that's some of the things that I've struggled with in the past, is there was no way of capturing that. So the complex discharge team would work with a spreadsheet and just a big long list of patients, and they'd save a copy every day so they've got a history, and it was just a horrible way for them to have to work. And there's nothing you can do with that information because it's just in this spreadsheet somewhere else, so you can't visualize that, you can't see that anywhere else, so it's very siloed. So what we want to do is then be able to come in, say what is it that you're trying to capture, what information is it you're actually recording, and then we can just build that very quickly, like within a day, just throw something together in the Cyferd platform, and then they have a system they can start using, and they can start sharing this information with people that are allowed to see it. It just empowers people to actually focus on their business problems rather than focusing on the technology that they're trying to use. I'm very tempted to say the data stuff because I'm a very big data person, but I think really the favourite bit about it is just how quick it is to set up new requirements, so how easy it is. So when I was in the NHS and when I was working as a developer, or even later on when I wasn't working as a developer but I ended up still doing work as a developer, I'd spend like weeks or months or even years sometimes developing a bespoke solution. So all the way from capturing user requirements all the way through to developing it and publishing it and training people. So that sort of process of days, weeks, months, years, I think can be simplified into like a day at the most. So rather than taking the business requirements and then thinking about how I'm going to build it and then building every bit of it, instead it's getting the user requirements and then just quickly building it in this platform using drag and drop interfaces, and then it just being ready. and that speed means that we can quickly prototype things, and if something doesn't work, fine, we'll change it. We can change it in a meeting with a clinician or with a manager. You don't like that, well, we'll change it. I like to really debate everything, but like define code. What is code? But really, for me, it's about coding is creating a system, creating the database, writing all the SQL or whatever database system you're using to do that, writing all the stuff that interacts with the database, stored procedures, tables, etc. Writing your front end, HTML or whatever technology you're using, writing your back end or your web server, doing something around deploying that, etc. So there's a lot of developery stuff and there's a lot of writing programming code. Whereas actually a lot of that we can simplify. So there's a business requirement and we write a load of code, but actually we can really focus on the business requirements and automate a lot of that code. So instead, with a no-code, low-code platform, the focus is around you have your business requirements and then you use drag and drop editors, so you can sort of drop a text box on the screen and that's where I want it. I don't have to write any code to do that, it's just there. If I want it to be a required field, I can just tick a box. I don't have to write custom validation. Or I can use wizards, so I don't even have to drag and drop stuff on the screen. I just say, this is what I want to capture. Please build me something. And we can scaffold out all the different views and all the workflows that would be attached to that. So essentially, you don't necessarily need a whole team of software developers building these systems. You just need someone with a problem and basic IT skills. I think data is done so poorly, and I think a lot of low code and no code solutions that might already be out there, they still focus quite heavily on design your database structure, develop your database, write all of your tables and how they link together. And we want to sort of take that away and abstract that a bit. You shouldn't have to care too much about how your data is structured. Just focus more on what it is that you want to capture, and we can handle the rest of that. So security, so I guess we would say we have like military grade security, and we have sort of like high gold standard security. So essentially what we're doing is we're partnering with BlackBerry. We're focusing on security being the key importance to us, and it really means that people using our platform don't have to worry. It means we have to worry, but hopefully we don't either. Using BlackBerry, gold standard industry end-to-end encryption, so you don't have to worry about when your information's sort of in transit. We're also focusing on how we can better detect when things aren't quite right. So there's various things we can do around detecting if someone's using an account that isn't actually that person. So if someone's left their laptop open in a shop and someone else is using it, we think we can detect some of that and then provide a risk score and potentially block that user, lock their laptop down. Or if someone's using the platform and they're doing things that aren't quite normal. So maybe day to day they fill in certain forms and then all of a sudden they're accessing a lot of information. That might be a bit of a red flag that maybe they're accessing things that they're allowed to access, but in the way that they're accessing it is troubling and perhaps something to follow up. So we want to be able to provide that sort of those flags to the security team, to the admins, to the organisation. So we're protecting your information, protecting the platform itself with industry grade, industry gold standard sort of security, but also then how people are using the platform. We're also analysing that and seeing how we can improve and detect malicious users. The game changer for the software, I guess two things: speed, so being able to quickly respond to new requirements, your software changes as you change, and centralization, so get rid of hundreds of software solutions, just have one. That's one thing to train your users on. It's one place to get your information. and essentially it's one system to buy rather than lots.